Oh, hey guys, quick little preface here. I don't have my intro to the video today because it's on my other computer downstairs, and I'm currently bedbound upstairs, and I bet you know why. Because you clicked on the video. So, anyways, I'm sorry that the quality on everything today is a little bit potato, but I think I'll be back next week as normal. So, thanks for hanging in. Bye bye.
Welcome back to my channel. I am Des Roulette and I had weight loss surgery, the vertical sleeve gastrectomy on Monday, which was 5 days ago. Today's Friday. Since I announced last week in my 50 Facts About Me video that I was going to be having the surgery, that I would just give you guys a quick update about how my recovery is going and what my experience was like in case you are considering it or you have any questions or you're just curious. There's always a risk associated with any kind of surgery that you get for any reason, any kind of open wounds. There's always a risk of an infection. When you go under anesthesia stays in your body for a little while. It also really limits your breathing. So the hospital gives you one of these, which is supposed to help your lungs to expand. You're supposed to use this 10 times an hour. There's nothing in it. It's basically just monitoring how much air you can get in. But I did pick my surgeon and I picked my practice very selectively based on their track record, their success rates, the statistical probability of patients having experienced any kind of adverse reaction or any leaks or anything like that. So basically, surgery went fine. Waking up out of anesthesia was brutal. That was definitely the hardest part of this whole thing so far. I was in a lot of pain when they woke me up and I was very nauseous. I don't know what the physical reasons behind that is. If the nausea is coming directly from the fact that you've just had a surgery on your stomach, or if it has something to do with the anesthesia or the medication or anything that they give you to prepare for the surgery. But I was very, very nauseous. I remember when they first had woken me up that I still had the breathing tube down my throat and I was just gagging, like pulsing, trying to get the tube out until they finally took this breathing tube out of my throat. My throat was just in extreme pain for days and days. It's finally just starting to subside now, but that's normal. Anytime I've had a surgery, I've always had that issue. You can't really avoid that. So it's practice that's in place to keep you alive. So you just make it work and you deal with it. But coming out of the surgery was very, very difficult. I was in a lot of pain. I was very, very groggy and upset. You know, it's like your mind's not quite in the right place. Like you know what just happened, you're aware of what's happening and where you are and what's going on, but you're just a little bit extra sensitive to everything, I think. So I was not a happy camper, but they rolled me into recovery. I was there for a little while. My husband came in, said hello. I was barely communicating with him because I felt so sick. I felt so nauseous. I just had like this little barf bag next to me in case anything was to come out. Thankfully, it did not. There were 3 instances after waking up from surgery that I was 100% certain that I was going to vomit. And I was kind of prepared for it. And I just had my little baggie and I was like waiting for it to happen. And I would get like the flow of saliva going, like your mouth starts to produce this excessive amount of saliva to prepare your body for vomiting. And that would happen. And then all of a sudden it would just go away and it would just pass completely. And of course there's nothing in your stomach. So it's not like anything's going to come up anyways. But there are people who will have a lot of nausea and a lot of vomiting after the surgery. I was worried about it happening, but it did pass. The worst part was being in the recovery room, and I remember once my room was ready and they were going to roll me out of recovery, they had to wait for a second person to help roll the bed, and I was just so uncomfortable. I remember laying in that bed and just waiting to move, and I was trying to sleep. Your brain is kind of in this weird space that like doesn't totally let you sleep, and I think the nurses don't totally let you sleep because they still have to make sure you're kind of awake and alert from coming out of the anesthesia. And I was just miserable. I just could not wait to move, and anytime they moved me slightly, it would sort of activate this pain. I'd be in more pain. But eventually they did move me to my room. They ask you your pain levels, they give you pain medication. So I did receive some pain medication that ended up helping me feel relaxed enough that I could sleep. And then I just really did a lot of sleeping. Oh, and I was so thirsty. When I was in recovery, I asked for something to drink. They gave me like this little mini sponge soaked in water, basically. So all I could do was like get this one little droplet of water out of this sponge, and which made me more nauseous, of course. And the nurse said that as well. But I knew I couldn't really drink any water. I wasn't really at that point yet. So when I finally got to my room, I asked the nurse if I could have water because I was so thirsty and my throat just hurt so bad. But it had been basically 12 hours that I hadn't had anything to drink. So by the time I got to the room, I just really wanted some water, and the nurse said she could bring me some ice chips. So we started with some ice chips, and after a little while, they tell you that you can start to sip some water. Now, you have to go very slowly, and you can only have a very specific amount of water. Of course, you're taking it easy the first day, and then by the second day, you have to drink enough that they're confident they can release you and you can go home and continue drinking without getting dehydrated, but you still have to follow the rules of how much you can drink. So this is an ounce. They give you these little cups and you have to sip one of these over 15 minutes over and over again. You'll fill this little guy up with water. They'll give you a bunch of these. They set these right up by your hospital bed, and then you have to time yourself because if you drink too much, it'll come back up. So you have to do these really tiny little sips over the course of 15 minutes, which doesn't really seem like it would be an issue, except you feel really stuffed, you're full of gas. You also just don't feel well, especially if you're feeling nauseous. But on the first day, I didn't have to monitor as closely how much water I was drinking because I was still hooked up to the IV, of course. They're making sure that you're staying hydrated through the IV. But it was on the second day when I wanted to get released that I had to be able to prove to them and show them that I could drink 4 ounces of water every hour for 5 hours minimum straight. And I had to get up and walk every single hour, at least once an hour. Going to the bathroom didn't count. And I also had to use my little breathy guy 10 times an hour. And you have to do all of those things for 5 hours straight before they'll release you. On Tuesday, when I was hoping to be released and I was starting to do my monitoring and starting to try to drink my water so that I could go home, I ended up having really severe pain and I couldn't focus on drinking. I felt so full and so uncomfortable, I just couldn't do it. So I actually didn't end up leaving the hospital on Tuesday night until almost 10 p.m. I was happy to leave because it's like impossible to sleep in the hospital. I had a roommate in my room that got wheeled out around midnight and they brought in a different person around 1 a.m. And then the nurses come in your room all night to take your vitals, and you also hear staff right outside your door at all times. So sleeping in the hospital is impossible. Not to mention the biggest issue that I'm still having, I sleep on my side, I don't sleep on my back. It's very difficult for me to sleep on my back. Also, when I left the hospital, I stopped taking pain medication because I don't take narcotic pain medicine, and that is all that they prescribe. So since I've been home, I haven't taken anything besides baby aspirin, which they recommend that you take chewable once a day to help prevent blood clots. That's also why you have to walk once an hour. And that goes on until you resume your regular activity, because if you have a blood clot that starts in your leg and it passes up into your lungs, it can kill you. So that's one of the more serious side effects of having any kind of surgery. Now that I'm home, slept Tuesday night kind of poorly because I had to try to sleep on my back. Moving at all is painful. My stomach is still sore. My incisions are a little bit sore, but actually feeling pretty well considering that I'm not taking any medications. Generally, I just feel like I'm moving very slowly. My energy is very low. I am trying my best to keep up with my water. I'm not measuring it at this point into the tiny cups. I can also have sugar-free Jell-O. I can have sugar-free popsicles. I've been having a lot of those because they're just very easy on my stomach. And some broth, 4 ounces at a time. But I am feeling a little bit of dizziness, feeling very, very tired, which I think is probably normal. Yesterday, my left thigh kind of went numb, and it's been that way ever since. It is still numb. I called my surgeon's office and I spoke with the nurse practitioner, and she said that sometimes that can happen after surgery. She said she didn't know if it's the way that they position you, but it's nothing really to be alarmed about. She said that it does tend to happen to people as well who have back issues, essentially that there's some nerves in my lower back that are being stressed that are therefore causing some numbness in my left thigh. But she said, you know, it happens relatively often. It's nothing to be alarmed about, but it's still there. So it's kind of a weird sensation that my left thigh is still numb. Other than that, I mean, the biggest issues are trying to keep up with the fluids, trying to limit the lightheadedness. Luckily for me, I don't have any nausea. I haven't had any nausea since those 3 instances in the hospital, I think that might be because I'm not taking the pain medication, and that's part of the reason why I'm not taking it. I would rather be in pain than be nauseous. I still have a lot of gas, still constantly belching, trying to get a lot of gas out. Pretty much every time you drink, you feel like there's a bubble in your stomach. So I'll swallow this, especially if I'm laying down, and then I'll feel this bubble sort of crawl up my esophagus and like turn into a burp. It's really hard to explain. The primary things that I'm noticing on day 5 and throughout the past couple days are the gas pains and discomfort in trying to sleep. Last night, I kind of got frustrated with being resigned to sleeping only on my back and being so uncomfortable sleeping only on my back that I just said, forget it. I'm gonna roll over and I'm gonna suffer this weird organ shift feeling that happens. And I did lay on my side for a little bit. I was able to sleep on my side for a little bit last night, but it made me more sore this morning. So as far as I've been told and as far as I know, it isn't dangerous to sleep on your side or toss and turn a little bit, move a little bit back and forth, but it can cause you a little bit more soreness. I am just hoping that by this weekend I'll be able to get out of the bed and move around the house freely and I'll start to feel back to normal. I mean, a lot of people don't feel well at all for the first couple days at least. I mean, there's a lot of people that have regret about getting the surgery immediately. I had a little bit of regret about the fact that I'll never be able to eat a normal meal for the rest of my life. I'll be able to have foods. They just have to come in such small portions. I'm just gonna have to adjust to. But I did have some regret. But I also rejoiced in that because I welcomed the change and I know that I have to eliminate those habits, the way that I've eaten in the past and the struggles I've had with food in the past, and I'm grateful that I'm not hungry. That's another thing I wanted to mention. Now on day 5, on clear liquids for 2 weeks, and then weeks 3 and 4 are full liquids, which is still primarily liquids, and yogurt, like a plain Greek yogurt is part of weeks 3 and 4, cottage cheese are part of weeks 3 and 4, pureed vegetables, things like that. No meat at all, but I can have like some protein shakes, like the Premier Protein, the sort of pre-mixed shakes. So I'm excited for the prospect of being able to have those flavors again, but I'm not hungry at all. My stomach has moments where it almost feels like it could be hunger, but it turns out that it's probably just gas. So I'll get a big hearty burp after I start to feel that sort of like phantom hunger pang. But all in all, things seem to be going fine. I'm very grateful that things went well and that there were no complications, and I hope that my recovery continues in a positive direction. And for those of you who were going through the same thing and had any curiosities about what other people's experiences were like, I hope that I was able to give you some perspective on maybe what's normal or what's not. My goal is to next week to be completely normal and active and make a better video for you guys. If you have any questions, just leave them in the comments down below. And thank you to all my new subscribers. Guys, crazy. I'm up to 222 today. That's nuts. A week ago, I think I had less than 200. You guys are killing me. So yes, I apologize for the slightly potato quality. Hopefully next week we can get back to normal. And I'll give you guys an update on my actual weight loss too when I've had a chance to get back to the doctor's office and when some of my bloating hopefully goes away. Thank you again for stopping by, and I'll see you next week.